California would like to sit in our studio audience, please log on to our website, thedoctorstv.com, or call area code 323-THE-DOCS. That's 323-THE-DOCS for show tickets.
Yeah, come on, man.
Wintertime is also dry skin time, so we invited dermatologist Will Kirby back to help you get rid of dry, flaky skin as well as chapped lips once and for all. Now, like many of you out there, Shannon has a dry skin problem that always seems to get worse during the winter months. Welcome, Shannon and Dr. Kirby.
Thank you very much.
So we were talking a little bit before about how dry skin can affect you if you're not moisturizing properly. And
it's pretty terrible. The medical term is xeroderma or xerosis. And what happens is the skin protects your body from drying out. We're full of fluids, and we want to keep that barrier intact. Let me just show you a quick visual. Imagine this is your skin. It's the stratum corneum, dead layer of skin on the surface. What moisturizer does is it smooths down that dead skin. And I know this is kind of an over-dramatic, and now I'm getting it all over you guys, visualization here, but nonetheless, that's what we want to do. We want it sloppy, we want it slimy. There's never too much, and I'm using a lot because I want you to use a lot too.
Okay. And you have a particular problem, you said, on your forehead.
Yes, definitely.
And just looking at you from a distance, you can't really tell, but as I get up close, very flaky, very dry. No matter what you do every winter, this comes along, right?
Yes, yes, I use all kinds of moisturizers and nothing helps.
Now, the reason this happens in the winter is not because of the ambient temperature in the house or outside, it's because of the lack of humidity. So I want to take a quick look and just show you how dry Shannon's skin is here. Let's take a quick look. If I put my epiluminescence up here, we're looking at her skin. You can see, look at that stratum corneum. It looks like the coconut husk, doesn't it? You can see how dry it is there.
And the stratum corneum is the outer layer.
It's the outer layer of skin, and it's already dead, but that's the layer that provides the most protection, and that's why we wanted to bring in the coconut, just so you can make that analogy there and understand how well you have to moisturize.
And you said an important word there, which is protection. It is a barrier, and when it gets dry and cracked, it loses that barrier mechanism.
That's exactly correct. I have a lot of rules for my patients. Do you have a bar of soap in your house? Mm-hmm. Throw it in the garbage. I hate soap.
Even if it has moisturizer in it?
Even if it has moisturizer in it. Bar of soap, they're terrible. You should not use soap-based cleansing products. Number two, people are obsessed with cleansing. Take a shower every other day. You don't have to shower every day. When you do shower, only the armpits, the groins, and the feet. Those are the only things you need to wash. You don't really need to wash the face. Okay. When you're in the shower, you have a new baby, you told me. In the shower or in the bath, bath time is not playtime for the baby, and bath time is not spa time for you. Shower should be 3 minutes in and out of the shower. And the most important thing in the shower is that as soon as you're done with it, or even during it, you're using products that provide extra moisture. I really like oils. You can use oils in the shower. Put it on, lightly pat dry when you're done. As soon as you're out of the shower, 3-minute shower, 3 minutes after the shower, moisturizing your entire body. And then there's all types of different products. There's ointments and creams. Those are the thickest. Creams are thicker than lotions. Lotions are obviously the most mild. Oils are the easiest to spread. The thicker the product is, the better and more moisture it's going to give you. However, it's also stickier and thicker. That said, I really love these types of products. I love deep moisturizers. Grandma's old-fashioned petroleum jelly and zinc oxide will also provide great protection, and they're very inexpensive. They look slimy. They're not going to give you a nice cosmetic result, but they're going to give you an excellent result as far as drying your skin. So for you, at night, I want you gooping up your forehead with this.
Any worries about acne with those types of products?
That's a great question. What we always worry about in acne is products that are comedogenic. They cause comedones or cause zits, and the truth is there's a lot of misconceptions. Oils like that typically do not cause acne. Acne has a lot of other causes, but that's not one of them.
And last but not least, anyone get chapped lips in the winter? I know I do.
Chapped lips are terrible. Why do we get those? Once again, it's not the temperature, it's the dryness of the air. So when you have chapped lips in the winter, it's like taking a clothespin and putting it on your nose and only breathing through your mouth. When you're only breathing through your mouth and you're bringing that dry air in and out, your lips dry out. Your lips are still skin. They're a different type of skin, but they're still skin. What do you put on there? Once again, put the petroleum jelly right back on there. Stay away from products that are colored. Stay away from products that have fragrances. You already have severe allergies. I don't want you getting into something that colors and fragrances. I want you staying away from that.
Well, good luck to you. Thanks, Dr. Kirby.
Nice to see you.
Doctor's orders when we come back.